We're going to stay in Gaza. And perhaps the first time famine has been declared outside the African continent, the UN-backed IPC has declared a full-blown catastrophic famine in Gaza City. The classification is characterized by, quote, starvation, destitution, and death, with 1 in 3 children acutely malnourished. Unless Israel's near-total blockade on food is lifted, the famine's expected to expand to Deir al-Balah and Khan Yunis in coming weeks. Many aid agencies have life-saving aid sitting in warehouses outside Gaza, ready to enter. For more, we go to Gaza City. We're joined by Tess Ingram, spokesperson for UNICEF, the United Nations International Children's Emergency Fund. Tess, thanks so much for being with us. You heard about what happened at Khan Yunis, at Nasser Hospital. Of course, there's so many patients there, children, adults, journalists, doctors, staff. From where you stand, this in the midst of the declaration by the UN that the Gaza Strip is in famine. Can you comment?
The rules of war are clear. Healthcare must be protected, as should journalists and all civilians, including children and humanitarian aid workers. And yet throughout this conflict, we've seen a constant disregard for the rules of war. And I saw it today here in Gaza City. I went to 3 hospitals, and at every hospital, I was met with rooms full of injured children, children with amputations, with horrific blast injuries, with fractures, with multiple shrapnel wounds and internal injuries. It is among the worst that I've seen. I was shocked by what I witnessed today in the hospitals. And on top of that, of course, we have the crisis of famine. Children with malnutrition at a screening centre I was at again today. All but 1 child that was screened had malnutrition while I was there, and that 1 child has been receiving treatment from UNICEF and hasn't gotten better over the last 3 weeks. But it is everywhere, Amy. Everywhere we look, children are being disproportionately affected by this horror.
Tell us what the IPC is. It's actually quite a conservative organization within the United Nations. If you can talk about what it means to declare famine.
They are quite conservative. They're a group of independent technical experts. So this group look at data specifically, and they look at it in the context of food insecurity. And they do this all the way around the world, from Somalia to Sudan, South Sudan. And now, of course, they've been watching the situation in Gaza for many, many months now. They actually first warned of the risk of famine in December 2023. And since then, they have been monitoring, collecting evidence and data. So for them to make this classification on Friday of a famine in Gaza City and the risk of that spreading and quickly to Deir al-Balah and Khan Yunis is a very significant moment. It is a rare moment for the IPC to make such a finding, and it is backed by 50 pages of evidence behind that claim. So we take that very seriously. Of course, we know here on the ground that the situation has been bad for so many months. One girl I spoke to yesterday, Sarah, she's 14 here in Gaza City, and she said to me, famine, of course I know, I've been starving for 5 months now. And I think that is the view of so many people here. But they were relieved that this really well-regarded group has put that on the international stage. And hopefully world leaders will take it and use it as a catalyst to finally do something to try and get more aid to these children.
Can you talk about the so-called Gaza Humanitarian Foundation? UNICEF, your organization, has been clear it will not participate in the militarization of aid. Over 200 NGOs have said that. Who are they? And what is happening when Palestinians race to sites, children, adults, to try to get food?
We as the United Nations, including UNICEF, have been very clear that we will not participate in the model that the GHF is using because it does not meet our humanitarian principles of impartiality, of neutrality. And what that means in practice really is that we take aid to people where they are in their places of refuge, and we deliver it to them with safety and with dignity. And we did that during the ceasefire as a good example. We had 400 distribution points all over Gaza so that we could bring the aid to the people where they were safely and with dignity. Now, we are seeing the opposite at the moment from these sites. There's just 4 of them. and we are seeing those apocalyptic scenes of people rushing to try and get what they can from these sites, of people being shot at while they are trying to do that. In our mind, that does not work. It does not meet the humanitarian principles that we adhere to, and that is why we are not working with that model. What we are asking for is for us to be allowed to do our jobs. We are being hampered every step of the way at the moment, and we want to be able to scale up. And we need to be able to scale up because a famine is underway in Gaza. It's more important now than it ever has been. So it's critical that the UN is allowed to work.
Can you explain what actually happens with these hundreds of trucks that are trying to get into Gaza right now?
That's right. We've got hundreds of trucks outside waiting to come into the Gaza Strip, including with life-saving supplies for children, equipment for hospitals that's so desperately needed. And there's no good reason why that cannot be allowed in with urgency. But what we're seeing is those trucks not being allowed to cross, for example, at Kerem Shalom in the south. But then we have challenges inside too. Even the few trucks that come into the Gaza Strip, those trucks are offloaded at a crossing, and then we have to get permission to go and collect the aid from the crossing. It's not a drive-through, Emmy. We can't just go there whenever we like to collect the supplies. We have to ask for permission. We have to receive what we call a green light to undertake that mission. Sometimes we might get the permission, but then we are delayed for many hours before we can leave, or we're delayed along the way. We face waiting at holding points. Sometimes for our teams, it can take up to 20 hours to do a round trip to collect the aid, which is obscene when this crossing is just a few kilometres away. And then, of course, if we do successfully collect the aid, we have to take it out of the crossing, again, with permission. We often have to travel down a designated route, which is not always a route that we would want to choose to take. Perhaps it's not safe. Perhaps it's a route we know where there are armed criminal gangs attempting to loot the aid. So there's so many obstacles that we face. And what we're repeatedly calling for is for these obstacles to be addressed. There are clear solutions. Give the UN more access to collect from the crossings, give us multiple safe routes inside of the Gaza Strip, and more important than anything, allow more trucks to come in, because we know that if we flood the Gaza Strip with aid, we will, one, reach more people with the supplies that they need, but two, we will address this desperation among the community and we will see the looting decrease.
Do you think your response to the Israeli Prime Minister Netanyahu rejecting the IPC famine report, calling it an outright lie, yet at the same time not allowing an international journalist to verify what's going on the ground?
To suggest that this report is a lie, it contradicts everything that we know, everything that we've been saying for months, and it's disrespectful to the work of the teams on the ground, to this body of international experts, and to the people of Gaza, to be having this conversation about whether or not it is true while children are dying. It's like we're living in an alternate universe. It's clear that children are starving. They're dying of malnutrition. A group of global experts has said that there is a famine, and those of us here on the ground are seeing it every day in our work, and we're traumatized by it. We are seeing children die every day. So there is no doubt in any of our minds that we're in a crisis, and that the solution to the crisis is to stop arguing about it, to open the crossings, and to allow aid into the Gaza Strip so that children can survive.
Tess Ingram, I know you have to go, but I want to ask you, you're speaking to us from Gaza City. Israel's defense minister has pledged to level Gaza City unless there is an agreement between Hamas and Israel around a ceasefire. Can you respond to the fear on the ground? 1 million people live in Gaza City.
Almost 1 million people live here, that's right. And every second one of them, half of the population, are children. And I think we have to remember that when we're talking about this. We're talking about a population where every second person is a child. And of course, these children have endured almost 2 years of the unimaginable, and they're exhausted, they're traumatized, they're starving. This is an area where a famine was just classified. This is an area where hospitals are full of injured children. I was talking to doctors today at hospitals in Gaza City about what they're going to do if the worst comes true and they have to try and evacuate. And They don't know where they will go. They don't know how they will remove incubators filled with babies or children from ICU units hooked up to life-saving equipment. This really is a situation that people are lost for words to describe and to plan for, and people are afraid. I was at a learning centre yesterday and I sat with a classroom of children and talked to them about it, and they're scared. Many of them have already been displaced to the south, returned earlier this year, and they don't want to do it again because they know that what awaits them down there is also not safe and not sufficient to meet their needs.
Finally, we just talked to Dr. Mimi Syed, who is a U.S. doctor who was denied entry, though she had been there several times in Gaza. She said this is increasingly happening for doctors. So you have more and more injured and dying. And is this true? Is this a threat that doctors increasingly are not being allowed into Gaza?
I don't know the details of how many doctors are not being allowed in, but it's true that there's a number of NGOs that work in the Gaza Strip who are at risk of being deregistered in the coming weeks, or their international staff not being allowed to enter Gaza. And that would be catastrophic for the response. So many of these NGOs are critical, not just in terms of medical care, but many aspects of the humanitarian response here in the Gaza Strip. So as a community of humanitarian workers, we've been speaking out about that and our fears around what would happen if we saw parts of this response not being permitted to continue at such a critical time for the people and children of Gaza.
Thanks for watching Democracy Now! On YouTube. Subscribe to the channel and turn on notifications to make sure you never miss a video. And for more of our audience-supported journalism, go to democracynow.org, where you can download our news app, sign up for our newsletter, subscribe to the daily podcast, and so much more.